Dr. Galland, it's an honor this morning to be here with you. You are one of the pioneers of functional medicine. Because of people like you, I have an opportunity and a career in functional medicine. So I'm just really honored to be here with you. One of my questions for you is, what does functional medicine mean to you?
Well, first of all, it's a comprehensive way of understanding the problems of patients, and I also view it as a physiologic approach to medicine. At one point, somebody had asked me, "Well, what's the difference between functional medicine and integrative medicine, and how are they different from conventional medicine?" And in thinking about that, I would say that the conventional medicine in which you and I were trained basically is focused around the theory of diseases. The idea is a person gets sick because he or she develops a disease. And so doctors are trained in the diagnosis and the treatment of diseases. And even though in medical school you're told, well, you treat the patient, not the disease, you are not given any tools for treating a patient. You are only given tools for treating a disease. And I've seen no evidence that that's changed in the 50 years since I was in medical school, more than 50 years. So that's the first thing. Now, integrative medicine really is mostly about modalities. The thinking in many of those modalities actually is functional thinking using a language that's different from the language of modern science, but it basically is the combination of modalities. That's what's being integrated. Functional medicine, in my experience from the beginning, was really about trying to understand problems physiologically in terms of body and mind, biochemistry and physics, multidimensionally, in a truly holistic fashion, but using holism with filters and focus, not in a very vague and general way. And I remember when I gave the presentation on patient-centered diagnosis at the first international symposium. Afterwards, Jeff Bland said to me, we gave he said, I really like the way you're talking about this. And I'm really understanding something about doctors now, because they had done a study at the, I guess it was the Linus Pauling Institute at the time that he was running, in which we took a whole bunch of people, we treated them nutritionally, and we showed how much better their health was. And when he would present that to doctors, they would say, well, what diseases did these people have? And, and it would kind of left him flummoxed. Like, well, but that is the fundamental problem with conventional medicine. And you can trace almost everything that's wrong with it to this theory of diseases. I mean, from over-treatment to the fact that so many people with chronic ailments don't get better because they don't know what disease do they have?
Right. So for me, when I have new patients come in, I totally agree. They come in from the traditional standpoint, and they're telling me what their conditions are, what their diagnoses are, what their diseases are. And the way I always describe it to my patients is, me as a family practice doctor, I was trained to listen to your symptoms, your diagnoses, and then give you the thing that's going to make you feel better, or make those symptoms go away. And for the majority of my patients, I tell them, I honestly, not to be rude, but I don't really care what your diagnosis is per se. The goal is going to be to try to figure out what's underlying right? What's underlying the disease or the inflammation in your body. So people that have no experience with functional medicine, it's just their kind of whole world is flipped around. another way I would describe it is that I feel like we're more collaborative with our patients. The old school model of you go into the doctor's office, they're kind of look over you, they look on top of you, they tell you what to do. They get annoyed when they are asked questions. Whereas for us, I feel like at least with me, I feel like I make a team with my patients.
I certainly would not have been able to learn what I learned without having a collaborative relationship with patients.
Mm-hmm.
And when I started out, I'd left academic medicine back in the late 1970s, went to a small town, decided, okay, I want to understand like what's really going on. Why are people getting sick? How can I help people get better with a minimum of drugs? And one of the first things that I realized is that I got interested in nutrition, for example, and one of the most striking aspects of treating people nutritionally as opposed to drugs, someone comes in with a problem and you give them a drug, there's a really good chance you're going to create another problem. And whereas if you can address that problem nutritionally, there's a really good chance you're going to solve their other problems. So if someone has arthritis and hypertension, the drugs for arthritis are going to make their hypertension worse. If you can deal with their arthritis nutritionally, their hypertension is probably going to improve. It was that kind of thing. When I got started, I would say to my patients in the small town practice, well, there are two ways we can approach this. I can give you a prescription, or you can make some lifestyle and dietary changes. And every patient would say, oh, I want to do it the natural way, doc. I definitely want to do it that way. But when I saw them a month later, they hadn't changed anything. And I realized that if this is going to go anywhere, I am going to need to understand how people change, what creates motivation. I wound up doing a fellowship in behavioral medicine, and I realized that nobody understood it. I mean, there's no magic out there. And I started finding that the patients that wanted to work with me were those people that wanted to make changes. So, just looking at the future of medicine, how do you create a sustainable medicine? It's by getting people to ask, by educating the population, by changing the social dynamics.
How do you think it can change, or what do you think needs to happen for people to ask more questions and to be more willing?
Look, the only reason that the work that we do has gotten any kind of acceptance is because of the role of consumers in demanding it. Without our patients advocating for themselves, and without consumers advocating, we would really be, under a rock somewhere trying to do what we're doing. So they are very important to us. And I think encouraging that, look, we are up against a multi-trillion-dollar establishment. It has a particular message that it wants to communicate. There are useful things that they offer. And even the theory of diseases, knowing what disease a patient has in the conventional framework is helpful. It's helpful in understanding the likely triggers and mediators of the disease, some of the genetic factors that you need to look for. And frankly, it matters whether a person has Crohn's disease or ulcerative colitis. Even more so from a nutritional perspective than from a conventional drug perspective, because of the way that people with those labels tend to respond to different nutritional therapies. So, there is a lot of value in that, and considering the trillions of dollars that are spent on it, there better be some value in it. Yeah. I think we need to keep getting the message out there, and we need to really support patient and consumer advocacy groups that have the political clout, or can if they're large enough.
To me, I think that I was already practicing when the internet was already being used, but I think the internet is being used more and more. And so I guess your experience with how you've seen that change, but to me, I kind of tell, like, I publishing a book in a few weeks on gut health, and chapter 2 is basically about why you should stay off the internet. And
Yeah,
when I tell people that, I'm always like, well, I'm cautious to say that because I know that my practice, I don't think would exist without the internet. And the thing that changed is that now when people go to a traditional doctor, they get a diagnosis or they get a medication, they go home and they get on Reddit or Google or Facebook or whatever, and they're searching. And then there's other people out there that have written like, hey, I was diagnosed with this. I saw a functional medicine doctor, and this is what happened. So I feel like that's allowing this spread of functional medicine. But at the same time, I've seen people that have literally just made themselves sick from being on the internet too much. The worst I saw was a gentleman in his 30s who was in a wheelchair that they're really, to me, he was just convinced, just reading over and over, and I think he put himself there. So I feel like it creates, it makes our jobs difficult in a way because a lot of people come in with the answers already, but at the same time, it wouldn't exist without that because people can actually search and find. So to me, it's kind of I guess the advice that I give is to do your research and find a practitioner that you trust, and then let go of the internet. Stop the searching and just trust the person that you're working with.
Yeah, I think it's a pretty individual thing with patients. I have a lot of patients that I'll just say, you've got to stop reading, because you're driving yourself crazy and making yourself sick with it, and you're getting a lot of misinformation. I have some other patients, though, who are actually pretty good researchers. And one of the things that I do say to everyone who will email and say, or call and say, oh, I read this. Okay, like, send me the link. Don't just say, oh yeah, I read this, what do you think about it? Send me the link, let me look at it. Let's see whether there's some real data here. What's the source? Sometimes sometimes your patients can help educate you.
I've learned a ton from my patients.
Sure, absolutely. I had something I want to ask you, because I took a look at your website, and what impressed me the most, actually, was a statement that you made there about how when you meet a patient, you want to go through basically the trajectory of their lives. Because I found that to be so much more important than any laboratory test. I mean, someone comes in to see me with an illness, I want to know, who is the person that this happened to? What were they like before? And so I was really, really happy to see that as your perspective. And I'm wondering, I sort of remember how I arrived at that. I'm wondering how you did.
I think most of what I arrived at is just when I was first starting out in functional medicine, I got to shadow some of the best people in the field. And so I feel like I was kind of watched them and saw how they approached it. Through my own practice, I've been out on my own for 7 years now. I would say I've just, I really, like what you've said in the beginning, like, I feel like I've learned so much from my patients. And I think it's just through not digging deep enough in the beginning, on focusing, when you start in functional medicine, you're excited about gut testing or toxin testing, and you just do that, and you forget about the person. You can forget about the person a little bit. And in seeing over the years, then, some people getting better, some people not. And what was the difference? And to me, this is where like my passion is in functional medicine is mental, emotional, spiritual health. And to me, that's the key that unlocks everything. And I could take 100 people with SIBO and treat them all the same, and half get better and half don't. And to me, what I've found is mental, emotional, spiritual health is kind of the key that unlocks that. And so for most people, that starts when they're kids, right? It starts, when we're children. To me, with a lot of people, it starts as trauma. And to me, trauma doesn't have to be something serious like war. One of the best definitions of trauma that I've heard is trauma is anything less than nurturing. To me, like my own traumas, my parents were from Poland and I was first generation, and it was traumatic being an immigrant in growing up here. And with the gut brain connection, which is kind of my other passion, I mean, when trauma starts as a kid, then the gut gets affected. And then once the gut is affected, then everything can go wrong, right? So I think it was just through, probably I learned that to ask about people's lives to get to know them, because learning from people that weren't getting better, right? When what am I missing here? Because the testing is pretty easy once you get used to doing it and you have experience. So I always tell people, I'm like, I hope that this is something simple, like you have a candida overgrowth or you have SIBO or you have dysbiosis, and that's it. And we treat it and you get better. And that definitely happens with some people. But for most people, it's more of a struggle, right? And so to me, the struggle usually lies with the person's story.
That's fantastic. And I think that perspective really is critical to functional medicine.
The biggest barrier that I find is just people that are in denial over it. To me, I always tell people the first step is just accepting that there could be something other than you just have to figure out the right supplements to take or the perfect diet.
Right. But the thing about the narrative, it's not only an emotional and spiritual narrative, it is a biological narrative as well. Yeah, and so sometimes helping the person if you start with the biological narrative, it helps people to be able to see this, that there's a spiritual narrative that goes with it.
Yeah, my greatest, I think, with hormones, right? When hormones are out of whack, then that makes mental, emotional, spiritual health almost impossible for people to really kind of get into, because I'm like, listen, it's not your fault. Like the hormones are getting in your way.
Right. Any illness can do that.
What do you think, going forward, what do you want to focus on? And maybe I can start with answering that. For me, I think that the greatest success, I think one of them that I could see in my practice is to start having more people that are coming to functional medicine for preventative health. I feel that at least for me, the majority of patients that I see, disease has already started, right? And then we're trying to either slow it down or reverse it. But I would just love to see, I mean, as a family practice doctor, I feel like I was trained to work on preventative medicine. And I think that functional medicine is preventative medicine, but not too many people come in to me to do that. So that would be one of my goals going forward, is just for that to become the focus is preventative medicine, not trying to reverse things once they've already started.
Well, that would be great if that could happen. My experience is that there are very few people who think that way.
Right.
And so I think that we need to be able to identify the pain, and how can we use your pain as a way to find a protocol, things for you to do that are going to keep you healthy for the rest of your life.
Yeah.
And so I do think, and there's no easy answer to that, but I do think we need to continue to do that and get better at doing it in dealing with all the patients that we see and the families. And I mean, the society needs functional medicine. We do not have a sustainable healthcare system.
I agree.
And functional medicine can make it sustainable.
That was fantastic to talk to you. And like you said, we can talk for hours, getting into more specifics. But I just, yeah, I'm grateful for you and your willingness to think outside the box and to really be an advocate for your patients, to allow something like functional medicine to grow, which gave me an opportunity to get involved in it. And it definitely changed my life. And it was definitely the best thing that happened to me in my career, for sure. So
Well, it
thank
was
you.
great talking to you. And it's exciting to me to see your perspective and your enthusiasm and your passion for what you're doing.
Thank you.